The key to fighting the COVID-19 pandemic is ramping up testing, and that's what's happening in Pune as well, which is now one of the worst COVID-affected areas in the country. A lot of active cases, but here you can see people are being brought in for testing. So once you come in for testing, the first thing that happens is that your details are taken here. Then, of course, the patient is checked for blood oxygen level. He fills in a form, and then he moves to the other end of the corridor where his swab will be collected. And these doctors in PPE kits will collect his swab samples, which will now then go for testing. These are, of course, the rapid antigen kits that are being used. Now, once your sample has been collected by the doctor attending to the patient, this is where it arrives. Here, of course, you can see the samples are tested. And what indicates a COVID positive case is 2 bars on the sample. So this is a positive case. You can see 2 lines here in the antigen kit, and of course the one on the left is negative because it has 1 line. And how is this key to fighting COVID?
Actually, when we find the high-risk contacts of the patient, our QRT team brings them to the CC center where swab testing is done. For the swab testing, first we do deep nasopharyngeal swab in a lying down position. That is taken in a culture, and then that culture is brought over here. There is just a simple kit where you put 2 drops or 3 drops of the solution inside it and wait for 15 minutes, and you will find 2 lines. If 2 lines are there, patient is positive. If a single line is there, patient is negative. That means you get report within a half an hour to patient's hand. Suppose the patient is symptomatic and even if his test is negative, then in that case we also do RT-PCR test in such conditions to confirm the diagnosis.
Right. So if someone tests positive, then they immediately move to this COVID care center so that they don't infect other people. Joining me now is Mr. Shantanu Goel, Additional Municipal Commissioner in the Pune Municipal Corporation. Sir, now this is a full center where you have testing and then you have a COVID center. How many such centers do you have in Pune, and what are the plans to increase it?
Okay, so right now from this month of July, we had started rapid antigen testing, and in that testing, daily around 2,500 to 3,000 people we are testing through antigen testing, and around 20% positivity is coming out of that antigen testing. Okay. Other than that, we are also utilizing our RT-PCR capacity, which is around 2,000 samples per day. The patients who come out positive are immediately taken into COVID care center, and they are treated here for 10 days. So that is how we are planning it.
जब हम घर पे थे तो हमारे बाजू वालों को ये कोरोना पॉजिटिव निकला, तो दूसरे दिन हमको यहाँ चेकिंग के लिए लाए गए, तो हम 4 जन पॉजिटिव निकले. खुद बचाओ, दूसरों को भी बचाओ.
बाकी काहीच नाही. ओके सगळं. हो सगळं ओके.
नहीं, ये बराबर है. खुद भी बचाओ, दूसरों को भी बचाओ. ये कोरोना का मकसद है, उसके साथ जीना सीखो अभी.
In the center which we are standing right now, this was the first quarantine center which we set up, and at that time this was set up for only foreign travelers. And as soon as we are seeing that the number of patients are increasing, because number of patients are increasing, number of critical patients are increasing. So in the lines of Mumbai and MMRDA, Pune Mahanagar Palika and Government of Maharashtra decided that we need to create a jumbo facility also in Pune, like in the lines of Mumbai. So in the Balewadi, right now we have around 800 capacity COVID care center for asymptomatic and mild symptomatic patients. But just side by side, we are going to develop a 600 O2 bed capacity and 200 ICU bed capacity in the Balewadi itself.
जेवण कसं आहे आजी? हां, नाश्ता जेवण बरं आहे? बाकी सर्व ठीक आहे? ठीक आहे. घरी कोण कोण आहे आजी? तुम्ही आहात. बरं. मिसेस पण निगेटिव्ह आहे. अच्छा, वाढलेली आहे. मुली निगेटिव्ह आहे. सगळे निगेटिव्ह. आजी फक्त पॉझिटिव्ह आहे. हो, काळजी घ्या आजी, काळजी घ्या. हो. बऱ्या होऊन जातील तुम्ही 10 दिवसात. कोणता दिवस आहे? चौथा दिवस. बस 5 दिवस हो. बस. मग पाठवतो तुम्हाला घरी.
It's a difficult battle. Cases are rising every day, but the authorities say that more testing, more detection, timely treatment and isolation is the only way forward. In Pune, with camera person Rajendra Dhayalkar, Saurabh Gupta, NDTV.